Hey everybody and welcome. It is officially July 15th and we are ready to start your 8-week wellness reboot. If you didn't see my post earlier today, I was making an example of how I indulged in gluten the last 2 days and how my ring suddenly became very immovable. And just to make my point, it really makes all the difference in the world. If you are struggling with achy joints, you wake up in the morning and your hands are killing you, your bones ache, I promise you by the end of this 8 weeks, you are going to be feeling so much better. Hopefully you're just jumping for joy and telling everyone you know, you've got to cut out gluten and dairy and sugar. But you know what? If you make a mistake, that's okay. Just like I did, I had 2 days of indulging, and it's like you just get back, on the wagon or pull up your bootstraps, whatever you want to say, and start doing better. We're all human. If you haven't read some of my recent posts talking about how I got to where I am today, I started off as a binge eater. I was overweight following thyroid cancer in 1984, ended up with a drug addiction, trying to lose weight, had body dysmorphia. I've done it all. And I became a personal trainer in 1992 to essentially help myself, force myself to stay in shape and eat right, and help others. So throughout the years, that has been my mission. I am 59 years old. I have been lifting weights since 1981. And I'm doing the best I can to stay with it, but my joints sometimes hurt. They're worn down from working out too much. And so I've learned to listen to my body, and I want you to do the same thing. There are going to be days where you're going to have a lot of energy. There are going to be days where you have none. And on those days, I just ask that you try and do something. And I'm going to show you some very basic things today. We're not going to start off fancy. I want to make this introduction very simple and achievable, because that's really the goal. If I tell you to overhaul your life as you know it and change what you eat and how you drink and how you sleep and whether or not you do an hour of exercise 7 days a week, I will be setting you up for failure. And I know this in my decades of fitness that it just doesn't work. It doesn't even work for me. So let's start off with baby steps. If you have not downloaded your welcome packet yet and you don't know where to find it, please email me or text me below. Let me know that you're having a difficult time. You want to print that out. It's got your first 2 weeks worth of breakfast, lunch, and dinner. You're certainly welcome to substitute. It's based on anti-inflammatory, no gluten, no dairy, very low sugar, and high protein. So you want to try and substitute something in that arena, if you will. If you have a cheat, again, that's okay. Try not to go off the deep end. What I used to do when I would binge eat, if I ate something bad, I was like, oh, well, I already screwed up, so I may as well keep going. And I would just eat and eat and eat until I was literally sick. And then I berated myself and, went through a lot of self-loathing. I used to stay home from parties or cancel dinner engagements because I had gained a couple pounds or I had already eaten all my calories for the day. And I don't want you to have to beat yourself up like that, because it really does nothing for you mentally or physically. So let's start with what works. I know this to be true. I've trained hundreds of people and I've trained thousands of personal trainers. And through all of the years and all of the diets, I am sharing with you basically a foolproof plan for success. So let's get started. You've probably seen my posts about squats. How many of you say that your knees hurt or that you can't do a squat? My God, if I had $1 for every client I had that said, I can't do a squat, I wouldn't be rich, but I'd have a bunch of dollars. So what I want to do is I want to show you a little self-assessment first, kind of starting from top to bottom. And the way we're going to do this, you can stand in front of a mirror, and preferably you're going to do this without your shoes. I have my shoes on, but I already know what my posture is like. And for those of you who have issues or concerns with balance, you can have a chair nearby in case you feel a little unstable. You're going to close your eyes for 5 seconds. And then you're going to march in place. And I want you to just kind of let everything loose. Don't try and stand like a soldier. And then hold your position. Now, obviously, when we're doing this on our own and we're looking at ourselves in the mirror, you're probably going to have to do this a few times. So each time you're looking for something else, just start over. Do another little march in place. If you had needed the chair, that would have been perfectly fine. And then just let your arms hang by your side. So the first thing I want you to look for, and I should have said put your hair back. If you're a guy, it's probably not a problem. But I want you to look and see if your ears are level. And you're just going to do this with your eyes. You don't need your fingers. Because if one side is tilted, let's say like that, more than likely you're dealing with a lot of tightness in that side of your neck. And I'm going to be very general here. This is not personal training. This is me speaking to a bunch of you with all different issues. But I'll show you some basic neck stretches to get you started. And even if your neck doesn't appear tight, they're going to feel really good. For those of you who are working at a desk or spending long hours in a car, or you're mommying and driving your kids all over, whatever. You can do these anywhere. The next thing I want you to look at is your shoulders. Is one shoulder higher than the other? And then ask yourself, if it is, do I carry my purse, my briefcase? Do I walk around with a kettlebell in this side? Okay? But oftentimes, you're either going to see the shoulder elevated or the head tilted, and it's kind of one and the same, usually coming from tightness in the upper trapezius, which are a very dominant back muscle going into your neck. So I'm going to show you the neck stretches that'll work all that. Now, the next thing I want you to look at is your hands. Now, for one thing, you might see that one hand looks lower than the other. In fact, it almost seems like my right hand here might be a little bit lower, which is probably accurate because I have a lot of pain in the left side of my neck. So if this is tight and it's elevating my shoulder, naturally it's going to look like my other arm is lower down. So this just reinforces what I'm telling myself, which is, Andrea, you've got to do your neck stretches. And I do. And I do range of motion for my head and neck so that I don't get any more arthritis. Okay? So we've looked at our hands. Now, if your palms are facing backward, that is pretty good indicator that you are tight in your chest. If you're working on a computer, you're driving, you're pushing, your baby cart or stroller, all of those things are going to cause this shortening and tightening in the chest wall. And then the opposite is that your back muscles become lengthened and oftentimes weak. So what we need to do with that is we need to strengthen our posterior, our back muscles, and we need to stretch our chest to open that up. So everything I've just covered is what we call upper cross syndrome, and it is a postural distortion or deviation that probably 80% of my clients have some degree or another. And if you're recovering from breast cancer surgery or head and neck cancer surgery, these are all very common based on the incisions, the reconstruction, scar tissue, adhesions. That also applies if you've had radiation to that area, because it damages the tissue and it in turn shortens, and or you may be experiencing a muscle spasm and a lack of blood flow to that area, so you've got a lot of pain and tightness. And as we open this up, you're going to notice that your pain is more than likely going to subside, if not completely go away. Now let's move on to our lower body, and I'm just going to march in place again just to kind of reset. And I know I'm wearing black, which makes this pretty difficult. And when you're doing this on your own, you can stand there in your underwear or completely naked in front of a mirror. The next thing I want you to look at is I want you to see if your hips are level. So is one hip like this or like this? If so, more than likely this wonderful muscle here called the quadratus lumborum, or the QL, is shortened, and that can elevate the hip. Now you may also have what we call a leg length discrepancy, where one leg is shorter than the other, and that's not uncommon, but the only way you're actually going to know that is if you go get x-rays. And I think we can try the stretches first before we go that route. Okay? The other thing, we'll do it sideways in a minute, but we're going to look to see if you have what we call a pelvic tilt. The next thing we're going to do, and I'm going to go ahead and roll my pants up over my knees here, because you may find yourself doing the same thing. We are going to look to see if your patella, which are your kneecaps, are centered, or are they rotating outward or inward. And you may know your own body and say, oh, I'm knock-kneed or I'm bow-legged. And these, sometimes it is just the way you're built, it's anatomical, but more often than not, it is a muscle imbalance. And so when we identify these things, we correct the imbalance, then we stop causing this undue wear and tear. Imagine this. Imagine if you are driving your car and you never, ever, rotate your tires, okay? So what if, instead of them being in alignment like this, what if one of them is just off slightly? This tire is going to wear out quicker, or the wheel, than the other ones. And that is what happens to our body as well. So by identifying these imbalances, by choosing the appropriate exercises, notice I said appropriate because not every exercise is appropriate. We can correct these imbalances, we can reduce or eliminate pain, and we can prevent future degeneration and injury. How do you like that? I wish somebody had told me this when I was much, much, much younger. All right, the next thing we're gonna do is we're gonna look at your feet. And I don't know how well you can see my feet here, but I want you to look and see if your feet are going straight ahead, or perhaps one of them is slightly turned outward. And that may accompany that knee being rotated out to the side as well. Additionally, you might find yourself rolling out on the sides of your feet or rolling inward. So this is called supination. This is called pronation. So typically when we have what we call knock knees, we have pronation, where your feet are rolling inward. And when we have more bow-legged, we roll out into supination. Now I'm going to roll my lovely pants back down here. All right, the next thing we're going to do, and this is a little bit more challenging because I need you to stand sideways, and that means you're going to have to look over your shoulder. But what we're going to do, we're going to march in place again. Okay, now it's pretty much impossible for you to tell if your head is forward. But if you could imagine a pen or a pencil going from your earlobe to your clavicle or your collarbone, your earlobe should be lined up right in the center. So even if you're looking out of the corner of your eye, if you're like, you kind of sense that you're, or do this, take your finger and go straight down and then turn around to the mirror and go, oh, well, my earlobe is here, it's not here. That means you have forward head, and that is part of upper cross syndrome. So again, you're holding your phone, you're typing, whatever, everything is forward. And so we have specific exercises that are going to correct that. And it's always going to be a balance. One thing is being strengthened and one thing is being stretched. The other thing I want you to look for, so just kind of shake it out again, in the front and in the back, you're going to feel a bony mass. Now I realize that not everybody has, 20% body fat, and it may be a little more difficult. That's fine. Don't worry about it. Sometimes you can just look at your waist. So like if my waistband was tilted like that, because my back was tilted, that is what we call an anterior pelvic tilt. So if you notice your waistband is lower in the front than the back, or if you can feel that bone and it is lower than it is in the back, so this is called your anterior superior iliac spine, your posterior superior iliac spine. Say that 5 times fast. Okay, that is an anterior pelvic tilt, and usually that comes from weak abdominals, tight low back muscles, and or tight hip flexor muscles and weak gluteal muscles. And you might go, oh, my glutes are strong, blah, blah, blah. It's all a matter of balance. So one thing can be more dominant than the other. It doesn't mean you're totally weak or that, I'm judging you. It's all about creating a balance and symmetry. And then on the other hand, you might have what's called a posterior pelvic tilt. And so we need to choose the exercises according to what you see. So what I want you guys to do in the next couple days, if you will, is to do this little self-assessment in front of the mirror and hit me up. Let me know what you see, because then I can tailor this to you. Right now, I'm talking to all of you. So I haven't met you. I don't know what you look like. I don't know what you do. Give me as much information as you can. Introduce yourself. Let me know how much you exercise or what your favorite healthy and non-healthy foods are. Let me help you to create the program that is going to work best for you. So the more information I have, the better the outcome's going to be. All right, I told you we're going to start very basic today, and I meant it. Now, for those of you who already exercise, continue to do what you're doing as we incorporate these other things. And you might find yourself saying, oh my God, I shouldn't be doing this exercise and changing everything up. I'm going to sit down just to pretend that I am in a car, okay? And you've got your steering wheel here. So for those of you who have forward head, which is probably 9 out of 10 of you, and probably including me, I want you can do this also lying down with a pillow under your head, but next time you're in your car, before you take off, we don't want you doing this while you're driving down the interstate. I want you to put your hands on the wheel, and a couple things are going to go on here. First, you're going to push your head back against the car seat headrest. Now, when you're doing this, you're not tilting down, you're not tilting up. It's literally like your face is getting smushed. Now, at the same time, I want your hands on the wheel. I want you to drop your shoulders and squeeze your shoulder blades together. So at the same, we're stretching our neck, we are stretching our chest, and we are strengthening the middle of our back by our spine. And lastly, I want you drawing your belly button towards your spine. So we're creating a neutral pelvis, because what I don't want you doing is arching your back in order to achieve all of this. So 1, we retract our head. 2, we depress our shoulders. 3, we retract our shoulder blades. And 4, we draw in our belly button. Now, if you're prone to migraines, keep in mind that this can stir up a migraine for some people. So begin by just holding it for about a second, and maybe do a couple of them, see how it does. Then you can build up to 3 to 5 seconds and up to 10 repetitions. The other thing, if you have high blood pressure, it is essential that you do not hold your breath, because that's going to elevate your blood pressure. So while you're doing this, you're going, and 3 full breaths is going to be about 3 seconds. So you can do it like Lamaze if you want, as long as you're getting oxygen in and out. All right. So this is called the head retraction, or the chicken, the funky chicken, whatever you want to call it. You could do this lying on your back, head on top of a pillow, and just simply push your head back against the pillow. Now, the beauty of that is, unless you're a vampire, you are sleeping, in your bed, in what we call a supine position on your back. And most of us have a pillow. So you could do this first thing in the morning when you wake up. You can do this right before you go to bed at night. All right, next, let's go through some neck stretches. If you have had a cervical fusion or any other neck surgery, please make sure, and I should say this for everyone anyway, please make sure that you talk to your doctor before starting this or any exercise program. Remember, this is not specifically tailored to you. I do not know your health history. I do not know your medications. So please make sure, you can share this video even with your doctor and say, hey, is this okay for me to do? So for most people, these neck stretches are going to be just fine. And I like doing these on the chair because I can actually grab onto this rung, which is going to depress the shoulder. So already I'm getting a stretch. And then all I have to do is tilt my head in the other direction, my ear to my shoulder, and I immediately feel that stretch. I could put a little pressure on my head. And when I say little, and when I use the word pressure, it's very loosely, because you do not want to be pulling on your neck. But you should feel a wonderful stretch through here, opening up that upper trapezius area. And then from there, let's just do everything on one side. You're going to turn your chin to your armpit. And now, instead of having your hand like this, you're going to turn your head. You're going to put your hand on the back of your head. You're still pulling, you're pulling up on the chair rung, but in turn, you're depressing your shoulder. Now the stretch moves around a little bit to the back, to what we call your levator scapula. And I'm holding this. I'd like you to hold each of these stretches for 20 to 30 seconds while you're breathing. There should be no pain, only a mild stretching sensation. That is really, really important, especially if you are recovering from surgery or coming out of treatment for my cancer patients and survivors out there. No pain, just a mild stretching sensation, okay? So we've done what we call lateral flexion, then we've rotated the head and gone forward. Now, I'm going to take you back to lateral flexion, but I want you to look up at the ceiling. You're going to feel that right here. These are your scalenes, and they are some miserable little suckers. Now, in whichever area, you might feel one more than the other. You can spend more time. If you're doing a stretch and you don't feel anything, you probably don't need to do that stretch. So then we're going to do the same thing on the other side. I'm going to do lateral flexion. Just assume I'm holding this 20 to 30 seconds. Then I'm going to turn my chin to my armpit. Remember, I'm only really putting my hand here. I'm not truly pulling down. Where I'm getting that action or that counteraction is here by depressing my shoulder. And then I'm going to go back to lateral flexion without my hand, and I'm just going to look up, feeling that right there. Okay, next, I'm going to tuck my chin to my chest. Many of you will feel this stretch without putting your hands on your head, but you can just literally let your hands rest here. Don't pull on your neck, or just curl your chin down. As you can tell, it's very difficult to talk while you're doing this. Okay, so those are our stretches. You can do those as often as you want, as long as there's no pain. Next, I want you to elevate and depress. So we're just not going like this. We're lifting up as high as we can, and we're reaching down, 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 down to the floor. And I want you to do this 10 to 12 times. Now, for my folks who are at risk for upper extremity lymphedema, typically head and neck cancer, breast cancer, you've had lymph nodes removed or irradiated. These are the beginning of the lymphatic drainage exercises. We are actually opening up the lymphatic pathways and your thoracic duct to help that lymphatic fluid flow with greater ease, because there can be a backup, which is what lymphedema is, when the lymph nodes or the lymph vessels are damaged, okay? And then we can do some shoulder rolls backward, some shoulder rolls forward. Really basic, and start with 5 or 6 of each of these. Hold your stretches for 20 to 30 seconds, and now we've got that all going to start with. Next, we want to stretch out your tight chest, which I guarantee you most of you are going to have some rotation there. So there's a number of ways you could do this. You could, lean against a door jamb and turn your body away from it. You can lean into a door jamb with your arms, but those are very hard, particularly if you're recovering from shoulder surgery or breast surgery or reconstruction. So just pretend I'm standing. If I'm leaning into the door, I want to step forward so that really my whole body weight is going in. I'm not arching my back as I do that. But let's start with something a little more safe. We have 2 options. One is we can pull our arms back. Now make sure you're keeping your head in alignment, belly button pulled in, and just pull back and down until you feel that really nice, gentle stretch. And we want to hold that for about 20 to 30 seconds. And that should be pretty easy, but I feel a good stretch. I actually went to the gym today and did some chest stuff, so that feels quite nice. Now another one is belly button in, hands here, and you're just gonna push your elbows back. Now make sure while you're doing that, you're not pushing your head forward and you're not arching your back. So check, and then squeeze the shoulder blades. Now you can hold that stretch, or you can do it in repetition. So 1 Mississippi, I squeeze my shoulder blades together, I relax. 2 Mississippi, checking myself. It's nice to do in front of a mirror because you can make sure your form is good. 3 Mississippi. Now for some of you, even me, because I need a shoulder replacement, that's hard. It's hard for me to just hold my arms up here. And so if it's difficult to hold your arms up, then go ahead and do this one instead, okay? Now what we were doing, while I was doing this, we were squeezing our shoulder blades together, but I'm gonna show you this from the back here. Try, anyway, and I call this the bird. So you want your arms just slightly lower than shoulder height, and I want you to squeeze your shoulder blades together without arching your back. You could also do it like this, okay? We're gonna squeeze 1 Mississippi, 2 Mississippi, 3 Mississippi, relax. 1 Mississippi, 2 Mississippi, 3 Mississippi, relax. And again, that might be really difficult because those muscles are probably much weaker than, it's not to say that these muscles aren't weak, but they're tight. So the tightness compared to the weakness, overcompensates. Now, if you do these in the next 2 weeks, I guarantee you are going to stand taller, you are going to feel better, you're going to feel more confident and self-assured, and you're not going to hurt as much. So let's just start with those for now for our upper body. And you can do these a couple times a day if you want, or you could do one of these in the morning, one in the afternoon. I don't want to put the pressure on you to do this all at one time. I want you to feel like, hey, I can do this while I'm watching TV, or I can do this, quite frankly, while I'm sitting on the toilet, or while I'm in traffic on the way to work, as long as you don't put yourself or anyone else in danger while you're doing it. All right, another thing we're going to do, many of you are going to have an anterior pelvic tilt and low back pain that goes along with it. And if you're sitting like this, you're going to notice this arch. So we're going to do an upright pelvic tilt for starters. Now, you can also, and I encourage you to do this lying on the floor with your knees bent. You are going to pull your belly button. Think about as if you were flattening your back. This chair is a little tilted, so it doesn't give you the exact depiction that I want. But I'm pulling in. Notice the very subtle movement here in my thoracic and lumbar spine. Belly button in, relax. And use your fingers if you need to for cues. Okay, you can also, keep your head back at the same time. So we are stretching out your lower back and we are strengthening your core musculature. Now I'm turning back to you. If you have forward head, okay, and you have neck pain, doing crunches is literally the worst. So I had to stop doing crunches years ago because I have chronic neck pain, I've got arthritis, degeneration, the whole gambit because I've overexercised all these years. So like I said, you can do this upright or you can do this lying down. Lying down is going to be a little more challenging, but just doing rotations. Now, for me, I have so many issues that I'm dealing with. I try and figure out what my body can do. So it might be just this. Maybe my arms and shoulders are tired today, or maybe not. And I'm going to go opposite elbow to opposite knee. And you should feel we're working your external obliques. We want to work a little bit of everything. So your muscles are layered, and your rectus abdominis, which is what we think of as your six pack. If you've had an abdominal tram reconstruction, your rectus abdominis is here now. So if you're doing a crunch, if you're even physically able to, which you're probably not, you're basically contracting your breasts. You're not strengthening your core, and you're creating more of an imbalance, and you are actually affecting the cosmetic result of your surgery. Let me know if your surgeon or your oncologist told you that one when you had that surgery. But we can just, I don't care how you do it, whatever you want to do with your elbows, or you can do side bends and just stick to one side. You can do this standing, or you can do this sitting right here. And this is great because you can do it while you're cooking dinner. You can do it in the shower while your conditioner's on your hair. You can do it anytime, any place, anywhere. Everything we've done so far, you can take on the road. And I know this all seems really basic, but let me tell you, if you can't do these basic things, don't worry about lifting weights. Don't worry about anything else yet. You have to have the basics down. And I promise you, the results are going to be so much better in the end. Okay, so we've got our upper body, we've done some core. Next, I want to address the lower body, okay? We have to be able to squat. So if your knees are hurting you, okay? Let's say when you're doing a squat, you notice your knees are going inward. What I need you to think about is pushing your legs outward while you're sitting. Now, put that chair right behind you. So if you fall on the chair. And so when my knees want to do this, I am gently pushing them out. If I want to sit all the way down, fine. Come back up. I don't care. You want a harder workout? Don't go all the way down. But this is totally fine. Now from here, I want you to push through your heels, squeeze your butt, blow it out, and inhale. And the whole time I'm thinking of pushing my knees out to the side. Now, if you have somebody there with you, you can actually have them place their hands on the outside of your knees, and you can gently push against their hands. Now, I am going to introduce this. I just ordered these off of Amazon. I don't even know what this brand is, to tell you the truth. But I'm going to open this up. These are my go-to when I travel. It's childproof. All right, and we've got different tensions. So I'm going to show you this, but I'm not necessarily assigning this to you today. But let's take, I'm going to just take, I think this is red or pink, which is a little heavier. All right, now, hear me. If you are at risk for lower extremity lymphedema, I do not want you using this band because it can restrict the blood flow. It can restrict the flow of lymphatic fluid. Although the risk is very low, let's not start there because just introducing these exercises to begin with is taxing your lymphatic system. It hasn't, perhaps you haven't exercised in months or years. So we want to see what your body can handle. That goes for those of you who are recovering from surgery, recovering from cancer, or just any of us who are like, hey man, I haven't worked out in a while, or whatever the case is, let's start from scratch. So I'm going to put my legs through here. Now remember, you're not doing this yet, but let me show you how wonderful this is because now all I have to do is push out against this little band and I can use more resistance or less resistance. And then I'm doing this in front of my camera or my phone, my mirror, whatever, okay? And I wanna make sure my thighs are parallel, my feet are parallel. I like to do this to kind of keep me upright as opposed to folding over. And if you do find yourself folding forward, usually that is also from tight musculature. So the more you can communicate with me, you guys, the more I can give you tips to make this better for you. So please reach out. Remember, you have me in the chat. You have exclusive access to me. You can also, post notes with the videos. I'm here for you. I'm here for you. So squats, let's work on squats this week. Every day, try and do a few squats. If your knees are hurting you more, either A, you're doing too many, B, your form isn't great. I guess it's just A and B. There's not really a C. So check your form. Feet are forward, thighs are forward, you're up. And even though, I can do squats, no problem, but doing them here and doing them slowly, the slower you go, especially on the way down, that is where you are going to feel that burn. So it's nice to have that chair. Now, if you prefer to do something, as long as you got a heavy chair, you can do like this and you can look. Your shins and your back should be parallel when you're doing a squat. So we don't want to see you falling forward like this. We want to be pretty upright. Okay, and I look down every now and then, look to see what's going on with my feet and with my knees. Now, I don't want to overdo this today, so I'm going to show you one more exercise which will save your knees. I've been to a number of orthopedic surgeons who have all said, do not do the leg extension machine. So you're sitting on a machine at the gym, you're loading the weight here. They said it is the worst thing for your knees. Now, you might argue with that, whatever. I want you to grab 2 big towels, and I'm going to show you this next exercise that is going to save your knees. And if you have a foam roller, grab that foam roller. All right, I am going to use this piece of furniture. I don't know, what do you call it? An end table or a server or whatever. And I'm going to lean against that. But I usually do this against a wall. Now, you're not going to be flush up against the wall because you won't be able to lift your legs at all. So, try not to get these knobs in my back. I have rolled up 2 beach towels. So here is a foam roller. I've probably, made this thicker than I need to. If you're using a foam roller, this is a 3-foot foam roller. You can actually get one that's about half this size. You may not be able to do both legs at a time, but you may not want to. It may be too difficult for you to do both legs at the same time. So what we're going to do is we are going to put this rolled up beach towel, my big watermelon, right underneath my knees. So you notice they're slightly bent. Now, everything that I've shown you so far, we want your head back and in alignment, shoulders back, belly button in, and I'm not flat up. I don't feel my, the piece of furniture against my back. I'm out a little bit. Now, we are going to lift our legs up and flex the feet. So you should be looking at my feet straight up and down. And I want you to start by holding it for 5 seconds and then drop them down. Then we're going to do it again. Make sure you're not holding your breath. Shoulders are back, head's back. And I use this opportunity to really squeeze my shoulder blades together. Keep breathing. Pull those toes towards you. You're going to feel that stretch in your calves, the bottom of your legs. Now, if your legs are burning, see if you can do 2 more. Always try and do 2 more if you can, as long as you're not putting yourself at risk. If your legs are shaking, then I would say stop, because I don't want you to fall if you're in a standing position. I'm going to do 1 more. Maybe I'm going to hold it for a little longer, this last one, until my legs are trembling a bit. All right. Now, what we're doing here, little anatomy. You've got a big, long muscle here called your vastus lateralis. You have a little one, like a teardrop right here, the vastus medialis. When we have a dominant lateral side, oftentimes we're going to see that outward rotation. That's not always the case, but we, in this exercise, are strengthening the vastus medialis. So we're creating more stability in the knee, and stability equals safety. Okay? When you have stable musculature, you're much less likely to injure yourself or to have an overuse injury. So it could be injuring because you fall, or your gait is off, or it could be you're doing too much and your wear and tear. Same thing, like if I'm lifting this and my foot is rotated out, I'm working different musculature. So we want the feet pointed straight up. I'll show you how it looks with the foam roller. I prefer the foam roller, but I don't want you to have to spend a bunch of money. And you can order all these things on Amazon. So same thing. Now I do 3 sets of 10 repetitions, holding each one for 10 seconds. Now I didn't start off doing that, but that is going to be the goal. And we do that a couple times a week. So let's start with these exercises. Everything that I have given you today can be done every single day if you want. You don't have to. But because we are not adding a load, we're not adding resistance yet. I did show you it with the band, but remember, we're not doing that yet. On Thursday, I'm going to start to add a few other things. So on Thursday, I want you to have either 1-pound weights or grab a couple soup cans. And if you are open to it, order a set of these bands. If I can get this container here on Amazon. I'm having a hard time. They are just called resistance elastic bands, but you want to make sure they are the circles, okay? And there's a bunch of exercises we can do with those. Throughout our time together, I will make some suggestions about some different bands that you can purchase on Amazon, but I'll kind of pace you, and you don't have to, okay? Some of you might be going to the gym, some of you might already have stuff, some of you might have a full gym in your house, and it's just, collecting dust, or you use it to hang your clothes. I hope this will help you get off to a really great, solid start. Again, please text me, write me, let me know what you see in that postural assessment. Let me know if you're confused or you're having issues doing any of these exercises. I'm here to help you. Today should be number 1 day on your meal plan, but if you didn't start today, it's fine. Tomorrow's a new day. If you need to sub out a different item, or you look at your 14-day meal plan and you want to eat the same thing 3 out of 7 days, I don't care. Whatever you like, because I know I'm not going to like everything on that either. And I want you to use that journal to keep track of, when I ate this, I felt good, bad, indifferent, miserable, fantastic. I slept like a baby, or I slept horribly. I tossed and turned all night, or my stomach was upset. Take notes. Let's try and correlate what you're eating with how you're feeling. And if you have a bad day and you eat a whole bag of Fritos and then you eat a thing of Haagen-Dazs, write it down. There's no shame. But why? What made you crave that? Could it be that you were tired? Could it be that your blood sugar dropped? Could it be that you were just in a mood, or you were just soothing yourself? All of these things are going to help us to figure out what makes you tick and how we can counter that. I wrote a post yesterday. If you look back, I'm trying to think of what the title it is. It's something about craving sugar. Please read it. It's such great information, and I'm sure it will resonate with all of you. It certainly did with me. So thank you for being here. I'm so excited to go through this with you and help you reach a new level in your wellness journey. See you next time.